This is Fido Friendly Travel Talk. Here's your host, Susan Sims.
Hey everybody, it's Susan Sims with Fido Friendly Travel Talk, brought to you by Animal Radio, where we talk about the travel and lifestyle for you and your furry best friend. My guest today, Dr. Henry Crossetti, is here to discuss his product Barkle and how this brush-free, stress-free solution reduces plaque and harmful bacteria. Hi, Dr. Crossetti, and welcome to the show.
Thank you. And I want to thank you for, on behalf of the dogs of the country and myself, for verbalizing and making people aware of this issue. Okay, they'll be extremely grateful. It's finally coming to light.
Yeah, I read a little bit about it. So for our listeners, if you could give me a little bit about your background and then what prompted you to start Barkle and get into the pet space.
Well, I'm a periodontist, and I practiced periodontics and practiced in Chicago for 48 years, and in periodontics, oral medicine, and I also had a breath treatment center. In 2010, I retired and moved to South Carolina, and a group of dental specialists who knew I'd had a breath treatment center came to me and said, would it be possible for you to come up with a product that we could use for our patients to correct halitosis, bad breath? Mm-hmm. And I said, well, let me look at it, let me see. And I got together with a chemist, and we developed a formula, and then we had these treatment centers tested. And I happened to be in Philadelphia giving a lecture on the product, and a gentleman by the name of Walter Cohn, who was dean of the University of Pennsylvania's Dental and Medical School, was there. And at the end of the lecture, he said to me, dogs. I said, dogs? But what about dogs? He said, this is a major problem for dogs. Mm. And the reason he was aware of it is Pennsylvania's dental school and their veterinary school did a lot of research together on periodontal disease in humans using the beagle dog. And so they knew just how significant it was. So we started doing a little research on it and found out a couple things. And where we got lucky is that we found out that, unlike humans, when we develop bacterial buildup in our mouth, it occurs first on the inside of our teeth. And the reason is because it's not self-cleansing. Dogs, however, do it exactly the opposite. They form plaque, which is the bacteria, on the outside of their teeth. The inside stays clean because the tongue of a dog, if you watch it, the way it moves in and out, and it's very, very thick and it's very rough, it keeps the inside clean. Well, that was a plus. The other thing we found out is that dogs can't lick their lips or their outer teeth. They can't do it. Okay, the tongue doesn't go there. So we came up with a gel, and we developed the gel so it would kill the bacteria that grew on the teeth just by contact. And so we found the way to apply it is just coat the teeth on the top and bottom. It takes about 2 minutes. And the other thing we got lucky about is that as much as dogs hate to have their teeth brushed, they love having their gums massaged. Mm-hmm. And it can't be the taste, because Barkle doesn't have a taste, but they just absolutely throw with it. And I think it's a emotional contact with the owner has a lot to do with that. It's like petting them. Anyway, so one of the issues that I think where this thing has got, the reason it's as bad as it's gotten as bad as it is that the average pet owner does not understand that the health of their mouth relative to plaque and bacteria is exactly the same as the dog's. Not the same bacteria, but the bottom line is that bacteria, every day, there's millions of them, and it multiplies. For you and humans, we came up with brushing and flossing every day to take off that plaque, and then overnight and so every day, if you're very religious about it, you can maintain your health and gums and health without any problem. For whatever reason, somebody decided, well, gee, if the toothbrush works for humans, wouldn't it work for the dog? And if you've ever seen a dog's teeth, you realize that you understand why they don't like it, because our teeth are flat and wide. Theirs are sharp, indented. I mean, it's just, if you were going to brush a dog's teeth and get rid of the plaque the way you do in your mouth, you'd have to spend at least an hour doing it if they sit still for it. Yeah. So what we did was we came up with products that are used for water and food purification, and we developed it into a gel so that when it's applied to the outer surface of the teeth, that's all that's needed, and then that will kill all the plaque and bacteria that's under that until the next day, and then you do it again. Mm-hmm. And one of the questions that, of course, comes up was, do you have to do it every day? Well, if you want to know if you have to do it every day, don't brush your own teeth for a couple of days and see how that works out. Right. Okay. So it's the same thing. The bacteria that are responsible for periodontal disease in us and in the dog are critical for oral health. They're the first stage of digestion. What most important is that bacteria that's in there protects us from things that go into our mouths that have bacteria and viruses on it, so we don't keep getting infections. Okay, so it's a defense system. Mm-hmm. So you can't wipe it out. Okay, but you've got to maintain levels, and that's what brushing and flossing does. And so the thing that we wanted to be sure of is that we wanted to be sure that it controlled the bacterial level and stay within normal limits if used as we recommended it, but it wouldn't change any other changes in the mouth, couldn't any other side effects. And so the way we did that, we did analysis of the actual bacteria on dogs and how Barkle affected it, and that's how we came to the conclusion, the dosage and the way we administered that. For young dogs, it'll prevent gum disease. For moderate disease, if you use it twice a day, it'll reverse it. And for advanced disease, the dog should see the vet, have the abscess or extract bad teeth out, and then go on to Barkle so they don't have to go back again.
Well, I have a quick question for you, because the whole time you're talking, I'm thinking of Honey. She's our 12-pound rescue. Her teeth are a hot mess because they're so crooked and missing, and that was a whole backyard breeder situation. And the last trip to the vet, she said that I should have her teeth cleaned, and I didn't want to put her under anesthesia. And so your product is kind of giving me a break, because now I can think about that's the alternative to that. Now,
so what I would suggest to you, okay, is that I would apply Barkle twice a day on her, once in the morning and once at night before she goes to sleep. I try that for about 4 weeks, and then I go back and see the vet again and get a report on that, on what they see. Now, it's not going to make loose or abscess teeth better, but it will reverse like breath odor and stain and that sort of thing if you use it religiously. And I think you'll be very surprised about how the response the dog will have to your application. The Barkle comes with a finger cot that you can put the gel on to apply it. I like to tell people to use their finger because they can get it in and in the back and feel the teeth and make sure there's a coating all the way back. Mm-hmm. And the more you leave in there, the better.
Yeah, I noticed on the sample that I haven't used it yet, but I've noticed on that where it said you should not use it. You need 30 minutes after they've eaten. They should not drink water, just so you can get the best effect, right?
Yeah, that's why the nighttime before they go to sleep is a great idea.
Okay. Yep. I was just going to say, and coming into the pet space, obviously, there are a lot of products on the market. So what can you tell us that makes Barkle different from some of the other products? I know I've received a lot over the years with a toothbrush, and she won't stand for that.
Well, here's the situation, my son, who happens to be involved with us on this thing, said to me, why can't you just come up with a device where they can just chew on it and that takes care of it? Why can't you come up with something we just put in the water or in their food and that will take care of it? I said, well, let me ask you a question. Do you do that? In other words, does your dentist ever tell you, I'll tell you what, go home and chew on this and you won't have to brush? There's two problems with the products that are out there right now.
Okay.
The first problem is that getting it on all the surfaces of the teeth where the plaque builds up. Mm-hmm. And you're putting it in water or food, it'd be random. I mean, it'd be no way it wouldn't be the same as your oral hygiene, for instance. And so, and the other aspect is most of these are holistic, meaning they say they got enzymes, they got this, they got that, but none of them claim that they will replace the need for brushing. Not one. Now, yeah, that's the big deal is there's no shortcuts here. So again, it isn't like, I mean, 2 minutes is not all I have to ask every day. The pricing is much less than a vet visit, and you can avoid the major problems you're running into. Well, do I put the dog to sleep? What if there's a major problem? Mm-hmm. I mean, so it's anesthesia, especially in younger or older dogs, right, is dangerous. And so, and not besides that, be expensive. So this is a way to prevent that.
Yeah. No, I'm thrilled with it, and I'm going to let you know in the month period. I'm going to try and take a before and after if she'll allow me. But before I let you go, you hit it right on the head that as we started our conversation, this is so important for all the pet parents out there, that are struggling with the same type of thing. And I know we've had dogs our whole lives, and I think we probably had 2 out of 10 have the anesthesia and have the teeth cleaning, and it was frightening. So, what other things would you like our listeners to know? I know.
Again, I think that if you own a dog, you obviously know how emotional it is and how they become part of the family. I mean, they become a big influence in the emotional of the owners. Okay, the baby boomers, they're replacing kids, and the millenniums, they went out and bought a dog for when COVID came along, so they had a companion. I mean, and there's nothing they won't do for them.
Right.
So the problem is that you've got to stop and think, because nobody's telling you that dogs live through their mouth. That's their emotional center. It's critical for them to get nutrition. It's critical for them all their toys, chewing, biting, it's part of their history. Mm-hmm. When they get advanced periodontoses and they can't chew, it changes their whole demeanor. Their activity level drops. But most importantly, these infections spread, and it can shorten that dog's life by as much as 2 years. If people knew that, mm-hmm. If somebody, so, and this is one of the problems we're having relative to making the public aware that the dog can be, we have a prevention for them, mm-hmm. but you got to prevent it. And what they really need to understand is that if they really love that animal and want to keep it a longer period of time healthy, and take care of its mouth. When somebody gets a dog, they're in charge of feeding it, giving it a comfortable place to live, vaccinating it, having it groomed, and they need to know they have to take care of their mouths, or they shouldn't own a dog. I mean, you would not purposely neglect that animal and let him get infected if there's something you could do about it, but they don't know.
Yeah. Yeah. No, I appreciate that. It's a good reminder. So everybody listening, go to barkle.com. And I want to thank you so much for taking the time to talk with us today.
Thanks for having me on. I'm anxious to hear how you like it.
Don't worry, I'll be in touch with you as soon as we do our little test. In fact, right after we're done, she's already had her little dinner, so I'm
But
gonna take care of our little honey. So thanks again. I so appreciate it, and we'll talk to you soon then, okay?
yes, thank you. Talk to you soon.
That's it for Fido Friendly Travel Talk. You have been listening to my guest, Dr. Henry Crossetti with Barkle. That is spelled Barkle. Log on to barkle.com to learn more. And for more information about today's show or just about traveling with Fido, log on to fidofriendly.com. Until next time, travel safe and leave no dog behind. This is Susan Sims with Fido Friendly Travel Talk.